What's going on? What's going on, y'all? It's Nick with HoustonCaseManagers.com. I know last week I was telling you that I wanted to start doing more lives just to kind of interact with people and just answer questions that they might have had about resources. So I want to start doing that today. But today I wanted to talk about Affordable Care Act plans. These are also known as Obamacare plans, Marketplace. These are health insurance plans that um, these are private health insurance plans. And what happens is if your income is low enough, the government will subsidize your monthly premium. So these are plans like Aetna, CIGNA, um, Blue Cross Blue Shield. That's another big one. These are all health insurance plans that you can get. And again, if your income is below a certain level, the government, they will help you with a subsidy to pay for that. Um, in Texas, like I've been working in community health for probably about 13 years. And before last year, I never connected anybody to ACA plans because here in Texas, they were just too expensive. Um, you know, People couldn't afford the plans that we were trying to connect them to. So again, I just never connected anybody to ACA plans. But recently in 2022, there was a lot of money that was pumped into the Affordable Care Act plans, and those made the plans more affordable, even here in Texas. So that's why I'm really trying to get the word out about these plans, Affordable Care Act plans, because they are a lot more affordable now. Um, they used to not be that way, but now you can find plans that have $0 premium. So um, probably what I'll do, I won't do that on this live, but I'll do a live that goes through how you can find these plans. And one place that you can find them at is called texasacaplans.com. And whenever you go there, it's really simple. That's either something that I can help you with to find a plan, or you can do it yourself. All you have to do is enter your zip code, you enter your household size, how many people live with you, and then you want to enter the income, however much income that you have in your household, and then you're going to see whether or not you can qualify for an Affordable Care Act plan. And like I said, again, it's very simple. So whenever I do that video showing you the process, like you'll definitely understand it. Yeah, but as far as like the Affordable Care Act plans, one thing that you should know is that a lot of these plans, they do come with $0 premiums. Um, and that can be a good thing and a bad thing because you want to get a health insurance plan that has the lowest premium possible. But sometimes these plans, they have deductibles that are sky high. And I've talked about this in other videos to where there are some plans to where the deductible may be, $9,000. And what that means is a deductible, that's the amount of money that you have to pay before the insurance plan starts to pay their half. So, um, typically insurance coverages, they help you with your co-payments, the cost of seeing your doctor, medical equipment, things like that. But if you have a health insurance plan that has a $9,000 deductible, you got to spend $9,000 before that insurance plan will kick in and start paying this portion. So that is one thing. Um, that is one criticism of Affordable Care Act plans is sometimes they have really high deductibles. But if you know where to look for those, um, you can pick a plan that has an affordable deductible. Or, like I said, if you want to contact me, my telephone number is at texasacaplans.com, or message me here. If you give me your information, basically the income that you make, your household size, and your zip code, I can find a good plan that has a deductible that is a reasonable cost. Um, but all this stuff, I mean, health insurance, I will admit it is a very boring topic. Again, if you do have questions about things like this, just let me know and I can help you guide you through the process. Or again, if you just want to go to texasacaplans.com and look there for your own plans, you can kind of, do your own homework there. but right now I got some downtime between contacting clients. So just entering basically information into the system. And this is typically a day in the life of somebody who deals with insurance. Is basically calling people and then entering information into a system. Calling people, entering information into a system. A very, very lit profession, I know. You know, another thing about health insurance is a lot of times, you know, people that will contact me um, after they've gotten like a huge hospital bill, and they're wanting to get health insurance because they want to see if that health insurance can potentially pay for that bill. And that's not the way it works. You know, you need to have health coverage before you go to the hospital, before you get a huge bill. Um, you know, one example of a health coverage that you can get to where it can pay bills that are in the past is it's called Medicaid retroactive coverage, and this can potentially pay for bills within the past 3 months. But the only catch about that is in Texas, Medicaid is extremely difficult to get for adults. If you're an able-bodied adult, if you don't have a disability, if you're not pregnant, it's going to be difficult for you to get Medicaid here in Texas. So again, that's probably the only health coverage that I know to where it can pay for hospital bills or things that are in the past. David D, what's up, man? My boy David, what them damn Mexicans. It's client track. All right. Insurance game. Very lit conversation. Man, what you got going on, man? Any events coming up? Look, man, you inspire me. All that work that you're doing over there, man. Okay, cool. And New Caney, what you got? Is it a concert or what you got going on out there? Action plans, goals. Summer Jam. Dang. I'm gonna have to check you out. You got some information on it on your page? Okay, cool. Okay. I'm gonna have to check you out. Um, Man, I don't know if I told you, but okay, cool. I'm gonna have to see if I can get a pass. I don't know if I told you, but man, me and my wife had twins, man, twin boys in January. So man, I've been so busy, but I have to see if I can get a pass to make it out. Okay, cool. Okay. Yeah, man, we already got, you know, we got a 3 year old and a 2 year old, so we've been starting to get out of the house, and man, it is a chore, you know, bringing four of them. Okay, cool. All right, we might have to do that, man. Well, Dude, man, at least you spaced it out though. Like, man, having four under the age of three, like, it is a lot of work, dude. It's like ain't no breaks, ain't no sitting down. Somebody always climbing on the couch or trying to stick their finger in a light bulb. Somebody need a diaper change. Like, so yeah, it's a lot, man. I finally understand how difficult it is. Well, listen, I'm about to jump off of here, but again, if anybody does need um, affordable insurance, yeah, little David, 20. That's crazy, man. That's a blessing, though, man. That's a blessing. Well, listen, I'm about to jump off of here, y'all. But if you do have questions about Affordable Care Act plans, and these are plans to where if you're under 65 and you don't have health insurance, these are plans where you can find affordable coverage. Um, Now, the key thing to remember about these is that you need to be under 65 and you need to be working. If you don't have any income, Medicaid might be better for you, or if you're here in Houston, Gold Card or the Harris Health, that might be a better option. But if you are working and you have a low income, typically Affordable Care Act plans are good for if you're working retail or if you're working fast food or just some type of job where they don't offer health insurance. Typically, that's going to be best suited for those individuals. So, if you do have questions about that, you can go to texasacaplans.com. Like I said, you can find coverage there. My number will be there, or you can message me here. So, man, just reach out to me if y'all need help finding health insurance. Whether you're under 65 or older than 65, whether it's for your parents, just let me know. I'm very knowledgeable about all that stuff. And, I can help answer any questions that you might have. All right. Y'all take care.